Hi, I'm Dr. Ray Benedetto, and thank you for joining me today on this short video. It's going to be on a topic that I'm sure may be near and dear to a lot of you out there who are watching this. We're going to talk about some of the childhood behavioral disorders, primarily ADD, ADHD, hyperactivity disorders. No doubt many of you out there know someone who has these. These children have been diagnosed with this. You have a child who's been diagnosed with this. So I hope this will be a valuable lesson today, a short video. And if it is, I hope you pass it along for somebody who you think might benefit. These disorders affect 17 million people in the United States, and that number is growing every year. 17 million, that's a lot. And again, more diagnoses every year. Most frequently diagnosed childhood psychiatric condition in America. So in our country, the most commonly diagnosed psychiatric condition in children. You know the symptoms, right? Brief attention span, poor concentration, careless mistakes, impatience, difficulty in school with their grades, both in learning and behavior. I'm sure you're all familiar with the symptoms. Hyperactivity, inattention. That's why they're called what they're called. Now, do we have better options for treatment for these people and these children who have these conditions? What's your conventional medical treatment, right? So your conventional medical treatment is medicine, right? It's drugs. It's things like Adderall and Ritalin and things like that. Now, those medications work. Those medications are given to children, and they work. They can focus better, and their behavior's better, and they can concentrate better. There's no doubt that those medications work. The concern, obviously, is some of them are amphetamine-based, antidepressants, things like that, and we really don't know the long-term consequences of giving medications like that to children. We just don't. So maybe there's a better approach, or at least a complementary approach, something that we can do with the medications to help. And that's where we come in a lot of times with patients, is we use a functional medicine, neurological approach to really start digging into what are some of the causes of the condition, and what can we start doing about some of those things to help these kids and to help these adults that have these conditions. So we look at things like digestive function, gut function. Right? A lot of these patients have digestive problems. We look at things like environmental sensitivities, right? So they don't do well with their environment. They don't handle typically stimulus from their environment very well. We look at things like food sensitivities. That's huge. That's long established that patients with these conditions, almost most of the time, I think 79% was the study that I looked at, and that was back in 1985. That these patients have food sensitivities. Has your doctor checked for them? Probably not. They just put you on the Ritalin and sent you on your way. Genetic defects, methylation dysfunction. So we need to look at some of the pathways genetically and biochemically. Nutritional deficiencies. Heavy metal toxicities like lead and mercury and all that kind of stuff. Or the inability for the patient to get rid of those heavy metals if they do come in contact with them. So detox problems. Fatty acid and amino acid imbalances. So again, nutrient stuff. And additives, food additives, sugars and dyes and all that kind of stuff. So there's a whole laundry list of things that we can look at to see if that particular patient may have difficulty with that's contributing to their condition. And then lastly is a neurological exam. I see a lot of these patients, and they've been diagnosed, and they've been put on medications, and they've seen a lot of docs, and they have never even had a complete neurological evaluation. Maybe some psychiatric evaluations, but not a neurological evaluation to see what parts of their brain might not be functioning like they should be. So it's a combination of looking for all those things, a comprehensive neurological exam. Let's start getting to the roots of the issues, and let's start trying to get them fixed. So that's it for today. Hopefully this was helpful for you. I don't want to beat the dead horse, but because I say this on all my videos, but it's just a difference in approach. It's not just making a diagnosis and giving someone medications to help manage the symptoms. Again, in this case, that's fine. It does help. But it's more so if we want long-term benefit, we want long-term quality of life, we really want to get to the roots of the problem as far as what's causing this, all these things need to be looked at. And 99% of the time, they're not. So do we have other better options, or even in combination with the medications, to really help enhance the quality of life and the health of our children and our adults that have these things? 99% of the time, chances are you watching this, you know somebody or you have a loved one who has this condition, these things haven't been looked for. Unless you went ahead and did them on your own, your doctor's not looking at these things. And they're all things that can be addressed, need to be addressed, and can make a significant difference in the health of your loved one who has this condition. So hopefully this was helpful for you. If you like what you see, please pass it along. Email to friends or family member that this may be helpful for. If you're on social media looking at this now, Facebook, give it a thumbs up or comment or share it. If you have any questions, please reach out to us, call, email. We're always here for you. So hopefully this was beneficial lesson for you today. If you have any questions, let us know. I'm Dr. Benedetto. Have a great day.